Have you ever felt like your body's just congested? And I don't mean like a stuffy nose or cold, I mean cellular congestion. Maybe you feel sluggish, or your brain feels foggy, or maybe you even have a metallic taste in your mouth, or weird headaches that just don't seem to go away. So you do the responsible thing. You go to your doctor, they run a standard metabolic panel, and they look at your liver enzymes. They tell you everything looks perfect, you're healthy, you're normal. But maybe you don't feel healthy, you feel like something's wrong, you feel maybe a little bit toxic. Well, in this video, I'm going to show you a lab result exactly from a patient that was struggling with this feeling. She was told that she was completely fine, but when we ran a specific elemental analysis on her blood, we found something that standard labs just don't seem to check for. We found that her body was carrying a massive load of neurotoxins, specifically mercury and lead. I'm going to walk through the actual chart that we talked to her about, explain exactly where these metals were coming from, because it's not from where you think, and I'm going to walk you through the protocol that we used to help her get them out. So without further ado, let's go ahead and jump into it. This patient, when she came in, she was struggling with chronic fatigue and what she described as brain static. She had a really hard time focusing, she was anxious, and she had this subtle rhythmic kind of tremor in her hands. She tried the generic detox teas, juice cleanses, she tried doing the saunas, infrared saunas, but nothing just seemed to work for her. In fact, some of those things made her feel worse. That's because she didn't need a cleanse, she needed something more targeted for her metabolic system. So we ran this elemental analysis. The test looks like this here on the screen, and it looks at two things side by side. The first one, nutrient elements, over here on the left, and the second one, toxic elements, here on the right. The first most prominent finding that we found that was actually concerning when we found it was this mercury level right here. Okay, look at the right side of the chart under toxic elements, this mercury level. One of the big things with this, when we're talking about mercury, a safe amount in this test specifically should be less than 4.35. She came in with a 35.13. That is 9 times the upper limit. Now you might be asking, how did she get this high? Did she work in some sort of a chemical plant? No, she was just living a healthy life, but she had two major sources of chronic mercury exposure. The first one, dental amalgams. So she had silver fillings in her mouth for over 20 years. Every time she chewed food or drank hot coffee, microscopic amounts of mercury vapor were coming off, putting that mercury gas into her system, into her blood itself. The second major source that she was dealing with was eating raw fish, eating sushi, specifically tuna itself. Somewhere between, some weeks it was like 3 times a week, other weeks maybe once a week, some weeks not a week. But point is, multiple times per month, she was ingesting tuna. So this wasn't an acute poisoning event. It was a slow, chronic drip of mercury going into her system for decades over time. And mercury, it's a neurotoxin that dissolves into fatty tissue within the body. Your brain's 60% fat. So this explains the brain static and the anxiety that she was dealing with. Her nervous system was literally inflamed by the accumulated burden of mercury within her system. And then if you look right above it, you see lead. And the second thing we found is that the safe limit with lead itself is 2.81, and she was at a 3.34. This often comes from old piping, maybe paint within the house, or old paint within the house, I should say. Even certain cosmetics. Lead itself competes with calcium in your bones and in your nervous system. So it's linked to cognitive decline, and it's also linked to fatigue itself. You combine that with mercury, so if you can go and you combine these two together, your body is then all of a sudden just fighting itself, trying to detox what's going on, and it's not working because the lifestyle habits that she's developed or the environment that she's living in is causing the dysfunction in the first place. So that was the first two big findings, the lead and mercury. The third big finding is going to be mineral depletion, or I should say mineral depletion. So if you look on the left side under the nutrient elements here, we're going to look at ones specifically. So I want you to see manganese, and I want you to see selenium down here. Both of them are on the low side of normal. The question is why? Because with manganese and selenium, your body uses those minerals to try and fight the toxins on this side of the column itself. So when we're looking at it, selenium specifically binds to mercury to try and neutralize it. So selenium itself, this person was running out of because her body was desperately trying to put out and fight the mercury fire that's going on all the way over here. So selenium and mercury directly linked like that. Moving on to the solution of this. So the question is, how do we help a patient that has this high of a mercury level? How do we help a patient that has this high of lead? Most people try to do this with aggressive cleanses or with some sort of fasting. That's actually very dangerous in a situation like this. You don't want to be doing that yourself. If you mobilize toxins from your fat cells without trying to catch them, right, or trying to detox them to get them out of the body, they just end up recirculating within the body itself. And because they're neurotoxins, they end up back in the brain. This is why people, when they do a detox on their own, they try. This is why people, when they do a detox on their own, they end up feeling sick or they end up feeling gross after the detox. So what I'm going to do, I'm going to walk you through here. Here's what we did to help this patient support her body's natural elimination pathways. So I'm going to take you through the phases. The first phase is we had to use binders. Okay. When we're talking about binders, we're talking about specific ones. So for example, zeolite is a binder, or activated charcoal is a binder. Think of these like a magnet within the body, within the gut itself. They don't get absorbed into the blood. They sit in your intestines and wait to catch the toxins that are coming out. Okay. Phase 2, let's see if I can get this working here. Phase 2 is the mobilizers that we have to put this person on. Once the binders are in place, so the zeolite, the activated charcoal, you can introduce metabolic support like liposomal glutathione or NAC into the system. Glutathione is your body's master antioxidant. It helps your cells push the mercury into the bloodstream itself so it can be filtered by the liver. Because we have the binders waiting in the gut, the toxins can then be caught and flushed out of the body safely. Okay, so that's going to be the mobilizers, number 2. Number 3, this is going to be mineral competition. This is the third big factor that you need to talk about when you're trying to actually heal rather than just manage symptoms. You have to replace what is lost. So if we're talking about the manganese, the selenium, because they've been fighting against this mercury, this lead, this toxic load for so long, you have to replace those 2 minerals. We essentially flooded her system with selenium and zinc, those 2 ones. These minerals compete for the same parking spots in your cells. By saturating her body with good minerals, you can crowd out the bad metals, which allows further detox in the body itself. It takes, in this case, it took about 4 months of this specific cycling that we had to do, but her levels came down. The body started healing, and that brain static that she was dealing with, that finally cleared up and that finally stopped. So all in all, successful protocol, but I wanted to show you this. The biggest takeaway that I want you to have with this is you probably aren't just getting older. Is that a factor? Sure, with some people it is. There's probably something going on that just hasn't been tested for properly, right? There's usually some sort of biological reason for the symptoms that you're experiencing. And a lot of times people just haven't gotten the right testing or haven't looked in the right place for it yet. As we saw with this patient, once you remove the interference, the body is able to heal itself. And listen, if you heard this patient's story and it sounds like you and you want more further help, you want to see if you have some sort of toxicity, maybe you have the amalgam fillings, maybe you eat the fish, and you're feeling the brain fog or the brain static and you're worried that you have some sort of toxicity building up in your system, there's a link in the description below where you can click to apply to work with us. Go ahead, fill out the form. We can help you schedule a call with our team.